Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, licensed psychologist.
And I'm Tara Prisco, physician assistant.
Sorry for the pause, everyone. I was closing a tab and then I was like, oh, it started.
But I am actually hooked up to hardwired internet at the moment, so hopefully there will not be any of that problem. Last recording we talked about how we were glitching and freezing. So we do have Ethernet ports in our house that we had put in like 12 years ago, but we never used them because Wi-Fi. And so I had to find which rooms we have them and behind which furniture they were.
Oh my goodness.
So I bought a 50-foot cord and it's all the way like to my master bedroom. And then this is like the spare room. So it's like through the hallway and plugged in.
That's fun.
But hey, look, hopefully we won't glitch because we'll have reliable internet.
I don't know. Apparently you said the glitching was amusing. So I'll find out when that episode comes out.
It was. I edited somewhat, but then I left in some of the silly stuff. So,
I mean, we're silly all the time anyway.
Yes. And so I was, saying that we got to see each other in person recently, which was exciting.
That was the first time in
a while. I don't even know.
6-8 months.
Yeah. And then we're going to see each other possibly again later this week, depending on circumstances.
Yes.
And then the week after for the Roselle Catholic Tricky Tray. This will air after it happens.
Yes.
But whoever wins the Medical Media Mixer basket, I hope you are now a fan.
Yes. And you're listening to this and you're like, that's me.
Also, actually, tying that in, not particularly intentionally, but somewhat, we do have that contest we're doing in April. So this will be in April when it is aired. And I received what we're doing as our gift, or our prize, I guess. It is from an Etsy shop. I'll put it up on screen here. And so it's from Duke City Spices. It's lemon lavender spritzer kit. So essentially you make like infused vodka and then you can use that in cocktails.
Or you can use it for gin.
Right. Vodka or gin. Correct. And then I have 2 packs. One I'm going to experiment with on my own. And hopefully, possibly this could become the official perfect cocktail.
Oh my gosh, that would be amazing. Well, it smells amazing because I have also seen this cocktail that Tara was holding up to the camera and it looks very cool. So if we can make something special just for the podcast about it, that would be amazing.
Yeah.
And the Duke City Spices.
Yes. And maybe one day, if we like everything, we'll do like a special little
collab.
Thing with it. Yeah. Like put our label on there with his or hers, whoever.
Them.
This Etsy shop is.
Yes.
And then, as we chatted before, I'm fighting a cold, but Sudafed and Motrin for the win.
Yes. And my voice sounds extra husky and sexy today.
It does.
Just enjoy it.
It's very, very soothing.
Yeah. My friend, shout out to Danielle. She's been listening and she says that she loves listening to 2 very intelligent women talk about smart things.
Ooh, go smart girls.
Yes.
I like
and she is a speech therapist, so maybe we'll have to invite her on for a consult episode.
Oh, definitely. There's definitely topics and things that we can cover related to that.
Absolutely.
Yeah. So, and we have our first email. Shout out to
Lupita, to our good friend Laura Santiago, whose last name now I'm blanking on. I'm the worst.
Burkholder.
Burkholder, that's it is. Sorry, Seth. Yeah, she sent us an email because she knows that I've been very sad and lonely for not getting any emails. So thank you to Lupita and to anyone else who's listening. I will also be grateful for your emails.
Totally.
medicalmediamixer.com@gmail.com. Wait, I said that wrong.
Yeah,
medicalmediamixer@gmail.com.
There you
go.
Too
excited. Sorry.
Too many .coms. They all started coming out at once.
.com.org, .gov.
I see you're drinking the the screen. It looks very cute. I like the glass. That like makes it too.
It does.
It's very pretty.
Well, we'll talk about in a little while. We got to talk about yours first. Mine is actually a mocktail.
Nice.
Yes.
Mine's very straightforward, so you'll see.
A drink is a drink.
Tis. And it's a Monday night and the husband is away on business and I have 2 kids there and a dog under the threat of whatever to be quiet downstairs.
You know what? It's okay.
All right.
It's real life.
So my cocktail, and I checked that we're okay. We don't have to censor this in the title.
Oh, yay.
Is called The Skinny Bitch.
You bitch.
It is very straightforward. Essentially, it is a vodka with seltzer. So it's 1 1/3 ounces of vodka. This comes from the Absolute website. So
you're a fan of theirs. You've gone to there for a couple of drinks.
Yeah, it's just, I guess they have a lot.
Sponsorship opportunities here open.
So 1 1/3 ounces of Absolute vodka. 5 ounces of soda water, as they call it. I have my nice Kirkland lime flavored sparkling water.
Shout out to Kirkland.
Go Costco. And 1/2 ounce of lime juice, freshly squeezed. So throw some ice in a glass, squeeze your lime over it, throw your vodka in, top it with your soda water. Good to go. I did mine in a little sort of mason jar glass because it was cute. And it's refreshing.
Nice. Oh, and I see on their website they've got some variations on it, so you can make it into other things too.
Oh,
Pop some raspberries in there for a little bit more flavor. Okay.
You can muddle some fruit in there in the summer. That'll be nice.
Nice.
So, the skinny bitch.
She's flexible, apparently. Sorry, I couldn't help myself.
I like it. All right. So I watched actually 2 documentary type things. First is CNBC. It's called Big Shot, The Ozempic Revolution, which was available on Peacock. And then I also watched The Skinny Confessions After Ozempic, which was Impact X Nightline, Season 2, Episode 20, which was available on Hulu. So these are both documentaries that focus on the famed GLP-1s, which I never thought a diabetes drug class would get so much press.
Who knew?
So I'll kind of go through what they do in each of the documentaries and then sort of a little of the factual stuff, a little bit of my experience in the world of prescribing these. So the first one, the Big Shot one, that one goes through some families and different individuals and how they sort of got into needing or taking these medications. So they start out with this family that are all dealing with chronic health issues. So it's a husband and wife and a daughter. The husband was diagnosed with diabetes at age 25. He has heart disease in his family. Both he and the wife did have bariatric surgery, but did regain some of the weight and had trouble keeping it off. And they were concerned because of the underlying family history of health issues. The daughter also was struggling her entire life, really. So she's in her 20s now. They show her, pictures from her childhood. And she even started off with bariatric surgery at age 16. So this is absolutely something she's been struggling with her whole life. And they felt that as a family, even, 10 years after surgery, they were gaining weight. They actually showed the daughter now, after all this, which is pretty neat. She's a doctoral candidate who's studying pediatric obesity. So because of her own experience, she's sort of paying it back, which is really nice.
Yeah.
This documentary was very good about separating fact from fiction, talking about each of the drugs, specifically which ones were for diabetes, which ones were for weight loss, because I think we're throwing around a lot of words and terms. And I'll break that down further, but, they do a really good job about actually reporting factual information. So I think that was really nice to hear, and it was a good, accurate representation of this. They did explain that these classes of medications are intended for lifetime. They are not meant for quick fixes, and they are not meant for just weight loss because you want to look cute in a bikini. They interviewed a couple of different professionals. One specifically was a doctor from NYU School of Global Public Health, a Dr. Virginia Chang. And then they actually went over and they went to another professor from the University of Copenhagen, Professor Holst, and he was actually an initial investigator of the GLP-1 class, discovering that molecule and what we could do with it. So it was pretty neat, kind of going all the way back to the invention of these medications. They did cover, that there have been some shortages in the past 2 years, 4 years, however long it's been at this point, because of the big uptake in these. And they went back and sort of gave a little bit of history about how this all happened and how these all were created. So Novo Nordisk, which is a Danish company, them and Lilly, which is another pharmaceutical company, Eli Lilly, they have been sort of having this healthy competition on treating diabetes basically since 1923.
Wow. I didn't know it went back that far.
Yeah. So based on innovation, they've had like I said, a healthy competition. First insulin, was initially invented in approximately 1923. And so back and forth, Novo Nordisk, came out with one drug, and then Eli Lilly would come out with another, and they sort of pushed each other for innovation in this space. So basically, where this came from is these drugs have been used for actually 20 years. These are not new. This class has been used. GLP-1 agonists have been used for 20 years for diabetes. The big turning point in obesity was in 2013. The American Medical Association actually recognized obesity as a distinct disease, which changed the way we look at it. And it changed our perspective on how we're treating patients. And so at that time, one of the Novo Nordisk drugs was out at the time, Victoza, their counterpart. So you'll hear about this, where the way that the drugs are FDA approved, they have to be named, marketed, studied, and their device, their pen, their injectable, one for diabetes and then one for weight loss. So even though they're the same exact drug. So the sister drug to Victoza was Saxenda, which came out in 2014. So this is, again, 10 years ago, we had a weight loss injectable. The difference was it was a daily injectable versus a weekly, which was more tricky with patients.
Yeah.
2018, so not that much longer, Ozempic came out. So again, it's not that new.
Right.
For diabetes. So again, it's a once a week drug. That's the semaglutide you'll hear about. And its counterpart, Wegovy, came out in 2020. That is the weight loss sister drug. And Rybelsus is the oral version of the drug for diabetes only.
And so does that mean there's probably going to be an oral version coming down the pike?
Not likely. I think that came out more in the diabetes space for patients who were concerned about giving an injection. But now I think in the past 5 years, it's become such a big normalized thing. I don't think that that's necessarily going to happen. Rybelsus is going to come out with more doses because they don't go up as high. But I don't think there's going to be other newer oral drugs coming out for weight loss. I think that people are okay with the injection. I think once they've done it, they realize it's not a big deal. And you can go a little bit more potent on the injection than you can on the oral. Because the way your body...
injection, from my understanding, it's similar to like an EpiPen sort of injection, where it just kind of goes in like
a
thigh or like a...
Right, or your belly. It's the devices are super easy, but unlike the EpiPen, I mean, these are like tiny, tiny hair-like needle. Like it's literally like nothing. So the competitor, so those were all from Novo Nordisk. The competitors who came out from Eli Lilly was Mounjaro in 2022, which is for diabetes, and Zepbound in 2023, which is for weight loss. Same concept, marketed differently. Pens are slightly different, but same molecule. The difference is Mounjaro and Zepbound are not all GLP-1. They have another receptor that they hit as well, GIP. So back sort of to the documentary, they did mention in the documentary that they are getting further indications. And so I'll go into more detail, but there are some new indications that are out for these, not just diabetes and weight loss, and there's more that's being studied. So they did talk about that. And then they went into children. So actually, Wegovy is is indicated in children now. So,
When they say children, how young are we talking?
12.
Okay.
Yeah, I mean, so it's understanding that this is a medical condition, a metabolic condition that can start at a young age.
And there's a lot of genetic loading for it too. So you could do all the right things and still be predisposed.
Absolutely. So they focused a little bit on this one child, Natalie, who was 12. She was already pre-diabetic and was on medication for blood pressure. She was being bullied. So she was part of a program at Duke. And the problem is, as much as she is a perfect candidate for this, and it would change the trajectory of her life going forward, I'm sure, and her health, her future health, there is not good coverage for someone like her. She happened to be, I believe, in the state's Medicaid plan. Her family, was coming from an area where they couldn't just shell out thousands, who can, for a drug. And so it was interesting to see that, like, this is a perfect example of something that we can prevent, starting now. But because of cost and coverage, that was an issue. And that goes across not just children, adults. So then they sort of jumped to the documentary into these telehealth companies that have popped up recently. And, the difference is some of these are legitimately, you're seeing a provider via telehealth and you are being prescribed one of these FDA approved medications, the actual brand names. One is called Row, another's called Sequence from Weight Watchers, and then Eli Lilly actually has its own direct company as well. But there's all these other companies that, because of the shortages of supply that were happening, they were allowed to do compounded medications. So compounded medication is where they take the molecule, say semaglutide or tirzepatide, and they mix it with some other fillers and they put it into a vial for you and you would draw it up and give it yourself. The problem is they're not approved by the FDA. We don't know what else is going into that mixture. We don't know where they're getting the semaglutide from. Like, we don't actually know where that actual molecule is coming from.
And that whole process reminds me a lot of when the medical marijuana boom kind of took off, where there were a lot of legitimate in-person providers, some legitimate telehealth providers, and then there are all these other kind of shady folks on the side who were just kind of handing stuff out, and you're not really sure where you got it, or telling you to go to this place that's not really an actual dispensary. So I feel like people are seeing this as a big business, both of these areas, and are kind of jumping in where there's a hole in the market, where people need these medications and they can't access them in other ways.
But the issue is it's like everywhere. Like, it's not shady in the back, alleyway. It's med spas, influencers, there's
it's the same with medical marijuana. Yeah.
And they're advertising like on the Super Bowl, like literally these medications or these compounded medications. So the concern with that is too, so somebody comes to me with side effects from that they're getting from somewhere online. Well, I don't even know what's in this. Like, I can't, like, how do I manage that? How do I know your dose is exact? Like, it's very tricky. But as technically as the supply chain is good, they should not be able to do that. So now I think Novo Nordisk and Eli Lilly are going back and suing some of these bigger compounding pharmacies, saying, hey, like, now you're, going against our copyright and all that. Interestingly, the reporters in this documentary actually went online on one of these sites, used their real heights and weights and BMIs that would technically not qualify, because we'll get into what qualifies for these by, the approval. And they were approved. So obviously, this is not about obesity. It's about just selling.
Yeah, it's about business.
The other concern is these compounded meds may not have preservatives in them. So we don't know in that vial what kind of bacterial growth, because you're constantly using the same vial over and over versus a single-use pen. And, again, we can't track these adverse effects. But of course, a lot of famous people are taking it, so it's become a whole thing. The other documentary focused a little bit differently. So the first one, like I said, went more about all this factual stuff. The second one, the Skinny Confections after Ozempic, the Impact Nightline one, they went a little bit more into the aftermath of this. So they covered one of the Real Housewives of Salt Lake City, Heather Gay.
Yes.
So you know her. Ooh,
Of course,
see.
I know all the housewives. Shout out to the housewives. If you guys want to come on the podcast or invite us somewhere, I am there. I'm there, ladies.
It was pretty interesting because, she talked a little bit about how she realized how much her self-worth was based on her body image, and whether it was better that she had the body positivity of just being a curvy girl, but healthy, because she was someone who was healthy, or whether now people value her more since she's lost weight. And so it was an interesting, take a look at things, because technically we're supposed to be using these in patients who hit certain qualifications. And I don't know if she had another reason to go on, but.
Well, the other part of it is she runs a beauty
right.
lab spa of her own.
She does.
So there's probably also a business side of it too, saying like, hey, I run a medical spa. I'm using these products.
Right. That was one of the things they showed later on. She didn't go about talking about selling it in her spa, but I'm sure it's probably.
Well, I'm sure her image is tied to it too. Like, if she's the owner of this med spa, she needs to look a particular way.
Exactly. So they did interview this Dr. Fatima Cody Stanford from Mass General Hospital. They talked about the social and emotional effects. They also featured this nurse practitioner who's a former bodybuilder. Her name is Stephanie Smith. She was saying that she was 47. She had put on 40 pounds. She felt it was impacting her ability to keep up with her children and her relationship with her husband. And they said that, she went on one of these medications to help with that. And she said it did help her to be more active. And they joked a little bit about how it helped her sex life because she felt more attractive to her husband. And she also runs a med spa and a Pilates studio. So again, it is all tied into that image of the person.
Then on the other side of it, if you think about it, this is someone who runs a Pilates studio and is ostensibly working there and doing all this stuff, and that's still not good enough. What message is that sending?
Right, exactly. And then the last was a gentleman who was on Mounjaro, I believe, for diabetes. He was a chef. He was in his 40s. His name was Jason. And after losing, 4 months and, I don't know how many pounds, it was like close to 80 at the end, he ended up filing for divorce after being married for 17 years. And he said it wasn't a direct result of the weight loss, but the weight loss helped him to take a step back and look at himself and realize that he was not happy. So it wasn't like, and if you saw him, it wasn't like, hey, I'm out on the town, I lost weight, I'm going to hook up with chicks. It's more like he had the confidence to say, maybe I'm not in a situation that's right for me. Yeah. So it was just interesting how we think about weight and health and obesity, but how it could impact your relationships. So that was an interesting take on things.
Yeah. And I mean, personally, full disclosure, I've had gastric bypass in the past, and I've gained weight because I'm not as thin as I was then. But I will say, when I was at my thinnest, I still thought that I was fat, and I was unhealthy. I was patently unhealthy. I was in doctors. I was having health problems when I was at my thinnest. So sometimes it's not about the weight, it's about health and finding out how to manage that. And for some people, losing the weight does equate to better health, but not for everybody.
Right.
Exactly. On how much weight. Like, I was definitely too thin. I mean, I look at pictures of myself now and think I was too thin. But at that point, I was like, damn, I look good. And now I'm like, ooh, that's a little Skeletor. But
yeah. I mean, there's definitely, you can be above the BMI that is prescribed and still be very healthy on paper. I think there's a lot of nuance to this, and that's part of obesity now being studied as a disease of its own. So I think that is very important. So let's just go into the definition of obesity. So we still use BMI, which is not a perfect number. And I'll tell patients this. I'll look at a person, I'll look at their frame, and I'll be like, listen, this BMI chart wants you to be this weight. I don't think that would look right on your body and your frame. Let's look for a health goal, not necessarily a number goal. But we have to have something to base it on, just like we have to have cholesterol numbers and blood pressure numbers. We have to have some sort of a parameter. So what's considered a normal, quotes, BMI is between 18.9 and 24.9. And I would have to say that below 20 is probably too thin anyway.
Well, and I was going to say, you probably don't have this, but like, what are the statistics of people who actually like naturally have that?
Right.
Probably very small.
Right. Well, right. And I think that's shifted, and we could go back to, caveman and be like, well, yeah, well, back then you had to like forage for your food or hunt it down. So it wasn't readily available and you had to walk everywhere, and the human body hasn't evolved.
Well, I was just going to say, I wonder, has the BMI chart changed over time as the world has changed?
No. BMI, I don't know exactly when it was invented, but this has certainly not changed, at least at minimum 25 years since I've been studying it.
And that seems problematic, just like knowing that our foods and our diets, what most people have access to, has changed drastically too. And so that impacts what you eat, which impacts your weight.
Right. So what's considered overweight is a BMI between 25 and 29.9. And then obesity is anything above 30. And there's class 1, class 2, and then class 3 obesity, which would be a BMI of 40 or greater, which would be, considered the highest. So the definition of obesity is basically it's a chronic, relapsing, multifactorial neurobehavioral disease where increased body fat promotes adipose tissue, adipose means fat, tissue dysfunction, and abnormal fat mass physical forces resulting in adverse metabolic, biomechanical, and psychosocial consequences. So that is an actual medical definition. It isn't just this person is this weight, right?
No, sorry, I made that face because I was looking at the link that you have in there, and I didn't realize that BMI is not dependent on age or gender, and that's problematic too. But anyway.
Oh, it is. Well, and that's why when I see a guy whose like shoulders are out to here and his chest is this big and it says he should be 200 pounds, and I'm, dude, don't go below 220 because you're going to look emaciated. This is your build. I mean, we'll give an example of my husband because he's not been listening. So we'll see if he listens to this episode. He listened to the first 3 and then whatever. He's just not a podcast listener. But anyway, his frame would never conform to BMI standards because he's got a big barrel chest and shoulders. Literally when he was born, his mother says, the nurses were like, look at the chest on that one. Like he's got big ribs. And that he couldn't be the weight they would want him to be for his height. It just
it used to be like a joke when someone's like, oh, they're big boned, but like that is a thing. Like your frame is your a certain size.
He's like, I was meant to pull a plow probably, like not be a sedentary desk job. But anyway, the whole point is now that we have a little bit of an idea of this, and there's a long way to go as far as understanding it. But the whole point is that people with obesity have increased accumulation of fat, but it's not always attributable to their calorie or their physical activity. There's more that goes into it. Right. They have impaired metabolic pathways, disordered signaling to their brain for hunger and feeling of fullness. So, there's a lot more that has to happen. But let me just go here. So I'm going to open my full screen. I'm not going to see you for a moment because I want to read this a little bit more.
My beautiful face.
I'm not going to see your reactions. Why is obesity more prevalent? So environmental influences, are for sure. We have an obesogenic environment, reduced food costs, except for eggs currently, apparently. Plentiful, high calorie dense foods, larger servings, reduced physical activity. We all take cars, buses, trains to get places, and the influential food industry. And basically it seems like the U.S. government food policies in the 1970s are considered a contributor to this. Also, the possibility of other things in plastics and chemicals that can affect our endocrine system. So that could possibly be part of it. Sleep deprivation is a huge one. Social networks. I'm sure that the screens have a huge play in this somewhere. Changes.
Which is ironic because if you remember when we were growing up, there was all of this anti-skinny models magazines because looking at all of that made us too thin.
Right. I know. It's very strange.
Which I don't think it really made us all too thin.
No.
It made some of us, but not everyone.
Random side note, because you just talked about the skinny magazines, and I saw this like meme or something online, or no, video that said, all girls of this Gen X millennial time read once in 17 magazine that you have to rinse your hair in cold water to close the cuticles so that you have shiny hair. And we've all been faithfully doing
Yeah, and it's
something.
especially good for curly hair, so it doesn't frizz.
But it's
What,
funny
that
is
true?
I don't know, but I don't think that's ever been like, it was literally a thing when we were around. It was in those little magazines, but I don't know if that's really been a
You
thing.
just blew my damn mind.
Well,
If
I
that's not a
told
real
you.
thing, I am devastated.
I texted you about Ed McMahon.
Well, yes. We could do a full episode on the Mandela effect.
Seriously, they're weird. But anyway, off topic, back to topic. Other things like our gut microbiome could also be part of this. And they're saying that it could be like an adaptation to our environment. Epigenetics also play a role. Epigenetics is how our behaviors and our environment impact how our genes are turned on and off. So there's a whole lot. So let's just quickly go through basically what GLP-1 is. So GLP-1 is glucagon-like peptide 1. It is a hormone we naturally produce in the intestines, and it plays a crucial role in our bodies regulating blood sugar levels and metabolism. So it stimulates insulin secretion. So it tells our pancreas to make insulin and to secrete it so that we can manage our sugar. The way this works is that insulin tells your body to take the glucose and put it in your cells to use. GLP also slows gastric emptying, so it gives you a feeling of fullness and slows down your digestion. And it promotes feeling satiated. Basically, it signals your brain that your body is full, and it reduces appetite and food intake. It also, I don't know why it wasn't listed in this little spot that I wrote it, but it also works on the way your liver pumps out glucagon or not. So glucagon is basically what your body does if it thinks your sugar's getting too low. It can sometimes overcompensate and spike your sugar, but it's a fail proof to prevent you from going hypoglycemic. And so it also affects the way that happens. So as far as the current medications, as we touched on, Wegovy / Ozempic, that's semaglutide. And Saxenda was the original one, which was Victoza, same drug, and then Mounjaro and Zepbound. Those are the big ones. There are others out there. I'll get to some of those because of the indications they have. But basically all the ones that I named are injectables. Other weight loss meds that are out in the market, the reason these became so big is other things we had more risks and were not as effective. So we had phentermine, which is essentially a stimulant. It's like give you speed you don't want to eat.
Fen.
Yeah. Well, the prescription version of it still exists. The fen was an over-the-counter thing that was pulled from the market because it caused all kinds of heart stuff. Mm-hmm. But essentially, it can't be used shouldn't be used in high blood pressure, in heart conditions. It can cause insomnia, dizziness, dry mouth. Another oral drug that we have out, which, I have used in certain patients, it's a combination of naltrexone, which is an opioid agonist. So mm-hmm. That's something we use to help with opioid or alcohol addiction, and bupropion, which is a type of antidepressant. These both, naltrexone, I think, works a little bit more on that sort of addictive behavior end of things. Wellbutrin just happens to have a happy side effect of reduced appetite. So there's a combination of those that can be used.
Which is rare for the antidepressants. Usually it's the opposite.
Right. Well, Butrin's in its own class. That's the difference. It's not an SSRI and SNRI. Again, you have to be careful with high blood pressure, heart rate with these patients. And if they're on other depression medications, you might not want to mix it depending on what they're on. I don't know if you remember Ally and Orlistat that was out. The one that made everybody poop on themselves.
No, but tell me more. That sounds fascinating.
That was out in, I guess, the early 2000s, and it went over the counter, but nobody really liked it. Essentially, it makes you not absorb the fat in the foods you eat. So like you eat potato chips or French fries, and then it slides right out the other end. So one of the warnings is like oily spotting, flatus with discharge.
I remember that anal leakage. That was
yes,
anal leakage. I've got it. I know I don't have anal leakage, but I know what you mean.
And then another combo would be of that phentermine, which we talked about, along with topiramate, which is Topamax, a migraine / seizure medication, which also had a happy side effect of weight loss. But again, a lot of side effects, not crazy effective. So that's why this class of medications has been such a big uptake because they're so effective and they're actually really have positive effects on the body. So as I mentioned, the GLP-1 class has been out quite a while. I have a little chart. It'll be linked in the show notes. But essentially, the first one that came out was Byetta, which was by Eli Lilly, and that was in 2005. And then the Victoza.
I hope they're going to pay us for all this commercial that you're doing.
I know. And then Victoza came out in 2010, Tanzium 14, Trulicity in 2014. It's been back and forth. And most of this is Lilly, Novo Nordisk, a little GlaxoSmithKline thrown in there, Sanofi, who my husband worked for many moons ago. They had one. I don't think that one really ever took off. Lixumia, I never even heard of it. But the newest generation, so 2017, Ozempic was approved. And then, like we talked about, all the rest that came after. So, here's where I find that these are very, very, very beneficial. They are being studied for some other secondary benefits, and some of them already have indications for this. So, Ozempic for diabetes, Wegovy for weight loss, actually has an indication for reducing the risk of major cardiovascular events, such as death, heart attack, or stroke in adults with known heart disease who are also have obesity or are overweight.
I'm sorry, I'm laughing when you said it can prevent death.
Yes.
Well, we should all be taking it.
Right, pretty much. So that's where these drugs, to me as a medical provider, are so beneficial. So I see somebody who might be in their 30s or 40s, and they have this family history of heart disease, and they're kind of headed down that path. Now we can say we're not just making you lose weight, but there are other metabolic effects that are happening from this. It reduces your sugar, it reduces your cholesterol. It's getting indications for fatty liver very soon. We're seeing the positive effects. So, that's where I find that I'm happiest about this drug class, is that I feel like I'm actually impacting the rest of your life, not just making you lose weight. And I don't think in all my talking, I didn't cover the indications for the weight. So it's a BMI of 27 or above. That would be the overweight category. If you have a comorbidity can be high cholesterol, high blood pressure, can be osteoarthritis of your knees because of the weight. There's a whole list of things, sleep apnea, or a BMI of over 30. You don't even have to have a comorbidity. And that goes for all of the weight loss ones. That's how the indication is written. So I am only prescribing it for weight loss in those circumstances. And then I'm just prescribing for diabetes in the appropriate patients. There are some things that we cannot, that would be contraindications to these drugs. And that is if you or a first degree relative at least has a certain type of thyroid cancer called medullary thyroid cancer. That is not the most common.
I hear that in all of the commercials.
Papillary is much more common. But if you have, or a direct family member has had medullary, we would not use this in you, because in their studies in rats, it did show that there was an increase in medullary thyroid cancer. It has not been shown in people, but we are not going to take that risk. Also, kind of hand in hand with that is something called multiple endocrine neoplasia, which is a family inheritable disease where you can have thyroid, adrenal, parathyroid, all these endocrine organs can have cancers. So we wouldn't use it in that circumstance. And that goes for all
heard
of
those
these
on the commercials, so we all know.
Right. And then as far as Zepbound, so they have an extra indication, not yet for heart disease. They are working on it, but they also have an indication now for sleep apnea. So moderate to severe obstructive sleep apnea plus obesity would be also an indication to prescribe this drug. And that's sort of like, yes, weight loss can help, sleep apnea, and sleep apnea can make it harder for you to lose weight. So that actually is a very smart indication for them to get. It helps me sometimes with getting it approved by patients' insurances. So that's super helpful. And Ozempic, the diabetes one, just got a new indication for prevention of progression of kidney disease. So to reduce the risk of kidney disease, worsening kidney failure, or death due to cardiovascular disease with diabetes and kidney disease. So that's a really neat one too. We're learning more and more that these drugs can prevent a lot of other things. So that's sort of the breakdown. I'm not going to go into all the studies. I mean, I read and I went through all the original studies. If you want to look them up, the LEADER trial, just the word LEADER all in caps, the SUSTAIN-6 trial, Harmony Outcomes trial, and the REWIND trial are some of the ones that cover the cardiovascular stuff as far as these medications. And just to clarify, this is not necessarily a class effect. That's why not every drug in that class, since 20 years ago, has the indications for prevention of cardiac disease. Some of them were unable to prove that. So the ones with the indication are the ones that we would use if we're really, truly trying to prevent cardiovascular disease.
Well, in the grand scheme, too, of medical trials, even though these medications have been around for a while, we don't have tons and tons and tons of research because it really has been, 20 years, and we're not necessarily following people for the full 20 years. These can be shorter term following patients. So knowing those long-term effects are still, TBD, but we're seeing positive progress in those areas.
Right. And then, as I alluded to before, there's currently, they're undergoing trials for treating non-alcoholic fatty liver disease, which is huge. I felt like I saw such an upswing in fatty liver disease since COVID. I swear it's like everyone was home and baking or something.
All that sourdough.
I don't know, but, basically, I think this is another forefront of preventable disease that they were looking at. So a bunch of the drugs are being studied currently for that. And they are doing studies in Alzheimer's disease as well, which is pretty neat. And they are also looking at them for alcohol use, psychostimulant, and opioid, as well as nicotine, because they sort of dampen that food noise, the food addiction. Some people had noticed that they're not craving alcohol or cigarettes or other things. And so now they're doing some deep studies on that, which is pretty neat. Yeah. And I believe you had also linked, and it's in our show notes, about some psychiatric uses that they're looking at for these as well. So it's a pretty interesting forefront for things. I'm not here to sell drugs. I'm here to treat patients appropriately.
I'm not here to sell drugs. I'm here to take drugs.
But I am here to say that this is not something that you should be afraid to come to your provider about. It's not something you should be poo-pooed about. It is a real thing. It is a real diagnosis. We want to help your future. And if we can impact you, it's never too late, but the earlier we can impact somebody's future health, and if weight loss is part of that, then why not? Go speak to your provider. But I would encourage everybody to also not use off-label shady pharmacies and get real FDA approved medications, just because I just don't know what the risks are out there. So
that should go without saying. Yeah. And for anyone who is curious about the psychological forefront for the GLP-1s, they're showing that there's improvements in depression, in diabetics and non-diabetics taking the medications, reduced anxiety and stress levels, help with eating disorders, which that's probably more of that addictive component you were talking about before, and then Alzheimer's, as you said, as well.
Yeah.
So it's kind of a whole new frontier with all that stuff, which is pretty cool if we could have one medication that can counteract a lot of major problems that most people have.
And I am finding on the diabetes end, I'm not needing to put patients on insulin as early as I used to, or at all, which is huge. Really amazing. Because the other thing about insulin is great, lowers your blood sugar, but actually can make you gain weight. So.
Yeah. Yeah. And you have to be careful with it. You have to make sure you're getting the right amounts, and making sure that you're monitoring your diet and the timing. And it can be really tough to manage if that's something that you have to go to.
Exactly. So, I thought this was something that's been in buzz for a long time, so we might as well tackle it. So hopefully got you some right information. There's a lot of things in the show notes with lots of links to appropriate sources. So definitely check those out if you want to learn more.
Awesome.
And I said mine wasn't long, but
you lied.
43 minutes in, and
dirty, dirty liar. Well, I said mine wasn't going to be long. We'll see what happens.
Yeah, we'll see.
So my cocktail today is a mocktail, as I alluded to before. It is called the Faker Face cocktail.
Ah.
It is 0.75 ounces of lime juice, 0.75 ounces grenadine, 1 ounce orange juice, and 2 ounces club soda, and raspberries. I froze my raspberries, so they're like little ice cubes in there. So you just combine the lime juice, grenadine, and orange juice in a cocktail shaker filled with ice, shake until chilled, strain into a coupe glass. My coupe glass.
That's what that's called? You're so fancy.
And then you top it off with the club soda, and then you could have some toothpicks balancing the berries on top. I said, F that. I'm going to put some frozen raspberries in there as my little ice cubes, and there you go. So you may say, what are you going to talk about if your cocktail is called the Faker Face?
Yeah.
I'm going to talk about prosopagnosia. Have you heard about prosopagnosia?
Nope. Just saw it on your notes. Just like capgrass. I am like ready to learn.
So I'm glad you mentioned that because it is somewhat similar to capgrass. It has to do with visually understanding something. Specifically, prosopagnosia is called face blindness. So have you heard of that before, if I put it in that context?
I have, yes.
Yeah. So I'm going to be referencing several things in the media. 2 of them I had planned, then one I just by mistake stumbled upon. I was like, I'm going to use that one too. So there was a film back in 2011 called Faces in the Crowd, starring Mila Jovovich. And going to be totally honest with you guys. As a movie, not the best. As a portrayal of what it's like to experience prosopagnosia, it is phenomenal. Okay. Basically, the plot of the movie is Mila plays Anna, who she acquires prosopagnosia after a traumatic brain injury. She witnesses a crime. The killer goes after her, pushes her off a bridge. She bangs her head. She wakes up from a coma, and now she has face blindness, which surprisingly enough makes it difficult to identify the killer of the crime that she just witnessed. Got it. So there's a whole bunch of stuff that goes on in the movie. Like I said, as a film, not top-notch, wasn't winning any awards. But what they do that is amazing is the way that they portray prosopagnosia is they have literally 6 to 8 different actors who look similar playing the same character.
Oh, that's neat.
It is so cool. Like, you need to watch this movie just to see what it would feel like, because when it first happens, you're kind of like, oh, wait, yeah, that's the girl from the other scene. That's her friend. Wait, is it? No, it's not. It's like they get these actors who look similar, and it's just so cool the way that they went about doing that. And the movie's really well done because it shows the emotional and social difficulties that someone with prosopagnosia may have, because especially if you're meeting someone new, meeting someone for the first time, you're not going to recognize them when you see them again. But with prosopagnosia, this also happens with people you've known for a while. You may not fully recognize their face anymore, or you may see them and know that it's them based on like the tone of their voice or their mannerisms, but their face doesn't quite match up. And so it can be very disconcerting. So as where capgrass was where you think the person is an imposter, this one, you know it's who it's supposed to be. It just doesn't look like them to you. And you know, like you feel that disconnect, like they don't look the same, but yeah, I'm pretty sure that's who it's supposed to be. There's also a book that I read 2 years ago. It was a book of the year, I believe, called Hello Stranger by Katherine Center. Have you heard of that book?
Nope.
It's a really cute book. It's like a rom-com. The main character, Sadie, she has a seizure caused by a cavernoma. Do you know what a cavernoma is?
Well, an oma means it's a tumor.
It is. It's not a tumor.
Cavernous sinus? Is something in the cavernous sinus?
No, a cavernoma is an abnormal cluster of blood vessels that can occur in the brain, spinal cord, or other organs. This particular one occurred in her brain and caused a seizure. And so after when she had the seizure, she hit her head. And then when she woke up, she had face blindness. And the doctors basically tell her it's probably going to be temporary. Once you heal up, it'll go away. And when you have an acquired just lost the words. When you have acquired prosopagnosia, it can dissipate after a while, or that could just be how you are for the rest of your life. So in the movie, Faces in the Crowd, Anna ends up having prosopagnosia for the rest of her life, although oddly at the end, she has a daughter and she always recognizes her daughter's face, and they don't really explain that. But it's a movie, so how true is it going to be? But in the book, Hello Stranger, which again, super cute book, it does eventually dissipate. And the plot of the book is Sadie has this medical incident while she's walking across the street, and some guy saves her, kind of like pulls her out of traffic to make sure she's okay.
Aw.
And it's like a very little meet cute. And then she wakes up in the hospital, goes on about her day. She is a portrait artist, so of course prosopagnosia is messing with her flow.
Wow.
But she ends up being able to use it in a very creative way to make her portraits look different, but still look like portraits. It's very cool, very artsy.
Cool.
But we find out at the end, the guy that saved her is the guy that she ends up falling in love with, who's the vet for her dog. Very cute. Spoiler alert. Sorry, guys. Sorry. But that is prosopagnosia portrayed in that book. And then recently, I came across a new show on NBC, so that's Peacock, called Brilliant Minds, which is actually inspired by Oliver Sacks. So are you familiar with who Oliver Sacks is?
I feel like I know this, and I feel
do.
like I've seen
Brilliant
You know who
he is.
Minds. Okay.
You want us to cover one of his movies.
Okay.
So he is a renowned neuropsychologist who has many, many books out there about the unusual cases he's had over his life. So he wrote the book Awakenings and the movie.
Oh, yeah.
But this show, Brilliant Minds, is also based on some of his case studies in his book.
Okay. Yeah.
So
names.
in this TV show, which is a really cute show, Zachary Quinto plays Oliver Wolf, who's an attending neurologist at Bronx General Hospital, and he has face blindness. He has prosopagnosia, which makes it very difficult for him to have relationships with his coworkers, with his, not necessarily with his patients. We'll get into that in a minute, but it makes it difficult. If you don't always recognize somebody's face, people are going to think like you're cold, that you're ignoring them, that you're kind of a jerk.
Right.
But he actually uses his difficulty with faces to help understand his patients more, because he's like, I don't need to see their face to understand their pain, to understand what they're going through. And so he really pays attention to what they're saying, what they're feeling, what they're experiencing, and makes that connection that way. So it's a pretty cool show. I may cover a particular disorder that they cover in the future. I haven't decided which one yet, but there's 13 episodes. It's a really good show. It came out in September of last year, so check that out.
I remember Zachary Quinto from Heroes, I think is when we first saw him.
Yes. And I didn't really think he was like super cute in that, but I like wasn't hating on it.
Yeah.
But he's like very like adorable in this. And there's like a little romance that like you're really rooting for him in the show. So it's a good show. And then I just really like all the Oliver Sacks movies and books. So to know that this was based on him, it's really cool.
Okay. So just a little side note as well. Heroes got killed by the writer's strike. I don't know if you remember this. It was a really good show. And then there was like a writer's strike. And then they came back in the end of the season, and like the finale, nothing made sense because it was like they threw it together. And I was like, it was so good.
I mean, you were going to be upset with me, but I wanted to, but I never really got into Heroes, which is crazy because it's totally my jam.
Yeah.
It's 100% my jam. But
Hiro Nakamura.
Maybe I'll have to go back. Yes. No, I know.
Save the cheerleader, save the world.
I know. I watched like a couple episodes, but then I just didn't stick with it. I need to maybe revisit.
That was also around the time of the TV show Lost, which also got...
Which I did not watch. I know.
Watch the whole thing and then throw it away because the ending is stupid.
I heard there's dinosaurs and it's kind of like Who Shot JR? Like it was all a dream. It never happened.
I'm just going to tell you this.
Wow, how old am I that I just quoted Dallas and people are like, what the hell are you talking about?
In the end, it's like the last...
In the end, nothing else matters? I hear a song in my head.
Which is disappointing. Anyway, back to you.
Sorry. So,
side quest.
Side quest. I love a good side quest. So what is prosopagnosia? It's a condition where your brain cannot recognize faces or facial expressions in spite of having normal vision. So it makes it hard to recognize familiar coworkers, friends, close loved ones. And it is a type of agnosia. So agnosias there's multiple different types, but basically it's when a sensory function isn't doing what it's supposed to do. That's the quick and dirty way to describe what an agnosia is. There's actually some famous people who have prosopagnosia.
Ooh.
Like Jane Goodall. So it makes me wonder if maybe that's why she was into being a primatologist, but primates have the most human-like faces of all animals, so then that throws that theory out.
But then are their faces as distinguished? I guess she learned, maybe it made her more in tune to their body language?
It might, and I mean, she was like studying primate behavior, so not primate faces. So
interesting.
The actor Brad Pitt has prosopagnosia. He does not know
Oh,
when he acquired it or, if he's had it since birth, but he does have it. And Steve Wozniak, co-founder of Apple, they all have come out
wow.
and said that they have it. Statistics vary, but it's roughly around 3% of the population has it, whether it is congenital, so you're born with it, or at birth. Wait, nope, that's the same thing, or acquired, so from an injury of some sort.
Okay.
So where was I? I have a lot of notes that I didn't read all of them. So different types of agnosia where the brain is not processing your senses appropriately, and this one is specific to facial recognition. So it can happen from sorts of injuries or lesions on the brain. So this can be from Alzheimer's or dementia. This could be another part of, like we were talking about, how capgras can be kind of seen. Some of those symptoms we're seeing in dementia. I think it's closer to prosopagnosia of what we're actually seeing in dementia and Alzheimer's. Brain tumors, traumatic brain injuries, developmental disorders. So there is some association with face blindness in folks on the spectrum, because we do know that people on the spectrum have difficulty not necessarily recognizing faces, but being attracted to faces. So there's a really cool study. I can't quote the exact time and date, so I'm sorry for everyone, but it's out there if you Google it, where they did studies on babies, those who were on the spectrum and those who were not. And those who were not attracted to faces, like human-like faces, but they were more attracted to animal or cartoon faces, where babies who were not on the spectrum were attracted to human-like faces. So there's something about facial recognition that's going on with that. And if you think about it, that can probably be leading to some of the difficulty with social reciprocal interactions. If you're not looking at someone's face, if you're not making eye contact, if you're not drawn to someone's face, you're not going to be looking at them, so you're not going to want to interact with them.
Right.
But it can also happen from hypoxia, so that's lack of oxygen to the brain, seizures, epilepsy, stroke, carbon monoxide poisoning, which is essentially hypoxia. But like I said, it can be from birth. There's a possible genetic link, but there's not a whole bunch of studies that are saying that that's 100% true. And so there's two different types of prosopagnosia, and this gets very hairy, so I'm just going to kind of general talk about it. Face blindness, like I've been talking about this whole time, is called associative prosopagnosia, so associating facial features to a person. But there can also be a prosopagnosia of just facial expressions or nonverbal cues. So you recognize the person, but you don't understand their facial expressions. And that is called the apperceptive type of prosopagnosia, which I would imagine is probably more rare. To have either of these diagnosed, it would have to be through brain imaging, yeah.
Right.
Brain imaging and diagnostic tests. And there will be a link in the show notes. There's this really, really cool website where you can go to. It's called testmybrain.org. And you can take a face blindness test and see how good you do at it. When you click on the link, you go down to the bottom right. It's called Famous Faces, and it wants you to identify famous people from their faces. So, of course, with this one, you have to know who some of these famous people are.
Right.
But it's kind of trippy how similar so many of them look. And then you're like, wait, I thought I knew
Right.
the difference
Isn't that
between this and this one.
Natalie Portman and Keira Knightley? I think people confuse.
There's more than
Amy
that on
Adams
this test.
and the other one that I always confuse, the Isla Fisher.
There's a lot. Michael B. Jordan and
I don't know.
Nick Cannon.
Oh, really? I don't know. I know Nick Cannon's mannerisms, so I guess I would know it from
And so that's the thing. These are just looking at faces, and it's removing like their hair too. So you're really just looking at the facial
that's
features.
really neat. Yeah.
And it really does kind of trip you up. So that's a really cool test you can take. It takes 8 minutes, and it will tell you at the end how well you do. So I included that in the show notes. And then basically, okay, so now you have prosopagnosia. What do you do with it? The treatments, so it can cause a lot of shame. Like you might feel badly by not being able to recognize people, or people might be upset with you because you don't recognize them. It can cause anxiety about social situations, embarrassment, and it can make people want to socially isolate. So the treatment is, one, to treat the underlying disorder. If it is acquired or from one of these other issues, we want to be making sure we're treating that first and foremost. But you can also have perceptual training. So perceptual training is when you focus on helping the person adapt to recognizing people in other ways aside from their face. So their manner of their gait, their posture, their body language, the color of their hair, their height, the sound of their voice, the way that they dress. Like in the movie Faces in the Crowd, every morning, Nina, I think that's her name, every morning, Anna draws a picture of the tie that her husband puts on that morning. So that way she can recognize him. So like little things like that you can learn. And in the book also, the main character, she learns other ways of understanding who people are that have nothing to do with their facial expression. Which, if you think about it, there's a lot more that makes up a person than what color their eyes are. Most people don't know the color of other people's eyes. So if you think about it from that standpoint, it's not so unusual. Other coping mechanisms can be just to, if you're comfortable with someone, being honest with them, helping them help you identify them.
Right.
And other ways that you can do. But that's really, you're not really fixing it. You're not changing the face blindness. It doesn't necessarily go away. In some of these cases, especially if you're born with it, you just kind of adapt and live your life with it. And that's the funny thing about it. If you're born with it, you may not even realize that you have it until some point later on, because you've just learned to figure out people in other ways other than their face.
Right. I think that's probably easier than somebody who acquires it later and has to learn all these techniques. Somebody who's been sort of compensating their whole life is different.
Absolutely. And the thing is if it's acquired, something else is going on too. So that might be the least of your worries. Like I said, having Alzheimer's, having other kinds of dementia, so it says there's this one chart here when they did a study of 336 individuals with probable or definite prosopagnosia. So some people, they weren't 100% sure. Primary prosopagnosia, like I said, they just had it. Posterior cortical atrophy. So that's a part of your brain is starting to shrink or to break down. And so it's affecting your vision and the way that your brain is processing visual stimuli. Alzheimer's, dementia, semantic dementia, which I've never heard of before. I'll have to look into that. Infarcts, tumors, and seizures. So those are the main things that can cause it. And I think that was everything that I had. But take that test. It's really cool.
Yeah, I want to do that. That looks like fun.
Yeah, it's a very, very cool thing. And they're still constantly doing research on it. If you go to faceblind.org/research, they're looking for research participants. So if you or someone you know is prosopagnosic or has other types of recognition impairments, they would love to have you join their studies.
Oh, that's pretty neat.
It is very cool. There's some really cool research going on out there and just really cool websites about this stuff. I'm guessing it's not quite as unusual as we think if they've got these websites out there asking people to join in. I think people are probably Googling this a lot.
Because people probably aren't coming in to be evaluated, especially if they have had it their whole life. They're just like, yeah, this is weird. People tell me it's weird, but, I've always been this way. So they don't go seeking medical treatment, but they might go and seek out, like you said, the web search and figure it out from there.
Exactly. And then the people who have it acquired, you're already undergoing other treatment for other things. So people may catch it sooner and then be able to point you in the direction of these other areas to get help.
Cool. That's super interesting.
Yeah.
I like it. So that means with Brad Pitt, I could walk up to him, say something ridiculous, and then come back later and say something else, and he might not know it's me.
I mean, maybe it's worth a shot.
Differently, different haircut, change my voice. And
I was thinking you could go up to him and tell him that you're either Jen or Angelina, and he would kiss you, but I don't think he's kissing either of them anymore.
No, I don't think so either.
He's kissing that other girl. He's with some new girl now.
Is he?
Just saw it recently.
I don't know his love life.
Yeah, I don't know.
So, a couple of things to recap about our contest. Go on Instagram and snap a picture of your phone or your car or your computer when you're listening to us and post it and say, I'm listening to #MedicalMediaMixer in and whatever location, state, or country you're in. And you'll be entered to win this cool little lemon lavender spritzer kit. And I have an update on a couple new locations of listeners, which I thought were fun. Let me open my app because I like the countries. That's always exciting when we have some new countries added to the list. So
yeah,
I think
going to get the competition going here too.
Yeah, I think last time our newest countries were Canada and Ireland, but we have added on Australia and Kenya.
The dynamite.
And whoever is in Russia has listened at least 3 people 1 episode or 1 person 3 episodes, whoever that is, and the Canadian friend as well. So I see that some of these people are coming back. So that's fun. I like to see like different people. The states are relatively similar to the standings that they were, although I think Pennsylvania picked it up and listened to a few more episodes since the last time.
Nice.
That's probably Laura.
I was going to say that's our
emailed
loop.
us.
She's listening.
But yeah, so the other states are relatively similar standing. So a little friendly competition. See if Florida can maybe reach New Jersey, or if one of the Carolinas can overtake Florida. In the race
who knows?
too.
Australia might make the win.
Seriously? I'd love, and then we could go there and we could field trip.
Just a short field trip across the globe. That's fine.
Oh. Our upcoming field trip and Career Day. We have an upcoming field trip to Career Day.
Which we need to talk after this so we can coordinate what the heck we're going to talk about in 2 days. But we are going to Career Day at our high school because you guys saw the picture of us graduating.
Yes. I put that up online. How cute are we? And our little cap and gown.
Yeah.
Career Day. We have the tricky tray at our school. We're doing all kinds of little fun things.
We've got our contest here. We've got lots of content that we're working on for you guys. Trying to think of more fun, exciting things. But if there's something you would like us to talk about, shoot us an email at medicalmediummixer@gmail.com. I would love some ideas of things that you want us to cover that you've seen in a TV show or in a movie or read in a book or heard on another podcast. I'd love to get input from you guys so we can be giving you the content you want.
Absolutely. All right. So thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers. And I did it correctly this time.
But did you stop it?
Not yet.